Happy Tuesday. I will be here with Dr. Connealy in a few minutes. She's just finishing up her patients for the day. And as usual, I want to welcome you to the Cancer Conversation. And I want to thank you for being here as always. If you're new to the Cancer Conversation, welcome as well. Again, I'm Dr. Roney. Dr. Connealy will be joining me in a few minutes. This session will be the last one of the 2023 year, and we're going to do more of a Q&A. And then the new year, Sydney, who's behind the camera, we were talking a little bit more about this and our objective for the new year. What I personally would like to do, just to share with you how we're going with this and what I'd like to gravitate into and kind of evolve, is we want to create a syllabus where, just like if you were taking a class or a course, when you go to take a class, whether it's high school, college, if you remember, they gave you an outline of how the course and the semester was going to go. And then they had the specific details. Week 1, it was going to be this, and week 2, and week 3, and week 4. And it's like chapters of a book where, you start here and then you build to here. That's what I'd like to do, as it follows the 4 pillars, right? All the testing, and then the starve phase and the kill phase. The modalities that we would use in pillar 3, which is how to oxygenate the body, how to alkalize the body, your voltage, how to increase the voltage, what we're doing to look inside the cell now. I mean, all those different things that we do, but in a very synchronized chronological order, if you will. And so that way one builds on the next, just like if you were in class, one builds on the next, you can follow much better. And I just think that's that's how my brain works. I just think it's a much better way to do it, as opposed to being a bit random. And I'm not saying that it's bad. I just think we could do a better job. And I personally want to put that together. The other thing I'd like to do is separate it a little bit, where we have cancer prevention, cancer care, the testing for cancer. But then what I have been studying for the last year or two is longevity. Right? And really longevity is synonymous with anti-disease. So that is what we're doing to learn about the cell, whether it's those trace minerals using the oligoscan and looking at how to create the polarity and the energy of the cell so there's proper communication within the cell. So there's proper flow of bad stuff coming out, good stuff going in. Proper oxygenation of the cell, proper alkalization of the cell, looking at the NAD and the mitochondria of the cell. I mean, really going in heavy to what they're learning, what the experts are researching and learning about cellular health. And if we have really good cellular health, then we're going to have good health overall. And we're going to be able to repair and replace cells faster than they break down. And that's what I want to get into. I want to get into what I'm learning as far as, these adversity genes that you may have heard of, your mTORs and your sirtuin genes, your heat shock and cold shock proteins. And what's happening and what they're finding is they are looking at these genes that aren't really turned on because we're such in a happy place, meaning we're not always cold, we're not always hot, we're not always starved. And those genes that are put into effect, if you will, when we are hot and cold and starved, actually help us. And they're learning that more and more. But because we're always pretty temperature regulated and we have food available, we're just not stressing our bodies in that way. And as a result, we're not creating, the best environment for ourselves to be healthy. So again, I want to put together that syllabus, if you will, that has both. It's the longevity, optimal health and wellness, along with cancer care, prevention, and treatment. And I think if we did both, I think we're really achieving part of the mission that we set out to do, which is make sure we're at the forefront of all of this. And I think we are. We have more modalities, and one of the slides that I'll go over covers that, which talks about our clinic here is combined with the wellness side and the Cancer Center for Healing. We're the largest in North America by far. and we have the most modalities and the most treatments and the most experience and such that right here at this clinic. And we want to be able to be at the forefront, whether it's teaching other doctors this integrative oncology, we want to be at the forefront. Whether it's teaching this longevity concept and optimal health concept, we're at the forefront. Of cancer care, integrative cancer care, we're at the forefront. That's what we're striving for day in and day out. And that's what we want to put together and have that in a format for these courses and these classes. So anyway, that's a lot. But I just wanted to tell you where our brain is going as far as how we're going to evolve this cancer conversation in the year 2024. Okay, so real quick, let me pull up the slides here. So I'll share the screen and we'll go through, and I'll do my intro. If you've been on with me before, I do a quick intro on the 4 pillars and give you if you're new to the cancer conversation, I like to give you a little bit of an insight on a plan. Now, I just had a consult with a potential new patient, and what I tell them is what I'll tell you. When I go over the plan, this 4-pillar plan, it's not biased to the clinic. The plan I believe in 100%. Anybody that calls me from out of state, back home, relatives, friends, was at a wedding, a couple weekends ago, and people found out what I did. They heard of the clinic. They were asking, what should I do for my friend? I tell them exactly this 4-pillar plan because I see it work day in and day out. Now, having said that, the clinic, like I said, we have the most experience probably out there. It's the largest clinic. We have the most modalities under one roof. We have a lot of high benefits of being here at the clinic for sure. However, the 4-pillar plan is really what I anchor to and what people call me from out of state, out of town, what I try to teach them across the board. Okay, so I hope you understand that part of it. So tonight, though, the conversation is going to be mainly question and answer, but I do want to get into a couple topics. So my CV is up there. Dr. Connealy, a lot of you have seen, she's been around in this forum for probably 35 years. If you haven't met her, she probably calls herself a reformed medical doctor in the sense that she is very much on the integrative side. Conventional, absolutely, if need be, but we would rather look at fixing the problem, looking at causes, identifying causes and fixing them instead of just band-aiding as a solution. So that's the gist of what we all do here. Certainly she heads that. Like we talked about, the Cancer Center for Healing is the largest in North America, multidisciplinary when you combine both sides. I think that's significant, so I wanted to bring that up. We're experienced in all stages of cancer now, and we list that. Typically, that's listed on the website and what we do and what we treat. And then we have this roadmap that we work on using different testing and the starve and the kill phase, the phase of immune boosting and oxygenating and alkalizing, and then looking at the causes, which comprise the 4 pillars, basically. So very comprehensive. It's located in Irvine, California. Great town, very safe, very clean. Beaches right here, probably 15 minutes tops. And then you have the mountains about an hour and a half away. So it's a good area. And people ask me all the time, okay, if I come, what else is there to do? They want to kind of combine their care with their family being out here. Ton to do. Okay, so very good area in general if you're not familiar. Okay, so before I get into briefly the 4 pillars and then start answering the questions, I want to go over this part because this goes into the whole wellness concept where we're realizing more and more, Dr. Connealy reiterates this constantly in our meetings, is what we're seeing today is different, okay? We're seeing cancers and disease processes that were typically, say there was a warranty, she'll say this, 40 to 50 years, 60-year warranty on a specific type of cancer. We're seeing it now in the 20s consistently. We're seeing more brains. We're seeing, they'll use the term turbo cancers, where they went from this to this almost instantaneously. And there's some factors that we believe are going into that. The point I'm making is what we're seeing on a day-to-day basis is just different, right? That's the best I could put it. There's a lot more going on. There's a lot more aggressive nature to these things that we're seeing, and they're happening at a younger age. So as we see this day in and day out, we need to adapt. And one of the things that Dr. Connealy wanted to put together that I want to mention is this early detection, almost human optimization plan. And this is something that there's just a huge necessity for. So I want to go through that and give you an idea of what you can do, because we get this question every day. Say a patient is here with their family. What can my family do while they're here, right? In order to get the right testing to make sure that we're preventing and or detecting things early, whether it's the husbands, the wives, the family, the kids, whatever it might be. So there's a new patient evaluation that's part of this. And then you could do, as part of this, the oligo scan, Molly's testing, the 3B body scan, which is a part of the one of Molly's tests, the blood microscopy, which is the live blood cell analysis, the EP scan, heart scan referral, Cologuard referral. So things that are going to look at the heart or look at the colon, we want to make sure that based on what you're presenting, whoever this patient is, that we have tools in the toolbox to not only look at you and look at and determine what I call fuels to the fire. What are things going on in the body that are increasing your immune system response, causing inflammation in the body? That's what it essentially, you study a lot of this, what it comes down to is inflammation, low oxygen of the cell, low nutrition levels of the cell intracellularly, low voltage, things like that, right? So we want to start looking at that to find out if you do have these fuels to the fire, which coincides, by the way, with pillar 4 in our 4-pillar approach. Day 2, we'll do blood work, right? And that blood work is going to be dependent upon history. And then we have our general panel, but then we could delve into a lot more if we need to, depending on the patient. We could do remaining assessments not completed on day 1, patient supplement review. We can meet with the practitioner, discuss the results or any options. And then we could do all these different optional treatments within the plan. So this plan, again, was thought out and put together as a preventative. Let's get on the diagnosing early as far as potential causes to cancer, right? Or any chronic disease, autoimmune cancer, heart disease, strokes, diabetes, things like that. And this is a good way to do that. So these are things that we're going to start putting together more and more, as I talked about, as it coincides with the cancer conversation in 2024. There's going to be a lot more push towards what you can do for wellness and health and longevity, or what I would call anti-disease. Okay? So this is just a really good option for that. All right. So before we start answering questions, let me do a brief overview of the 4 pillars. Okay? So this is the plan. This is what I see work day in and day out. This is what I believe in firmly. I believe this plan not only is a plan that you can follow in the details of it to maximize your upside and minimize the downside, but I also talk about this plan with patients that, say, are recently diagnosed. Their brain is spinning. There's a lot of fear, a lot of anxiety. And in the conventional model, and I apologize if you heard me say this over and over, but there could be new people on, so I want to make sure that I reiterate this consistently, is that in the conventional model, you have no control, right? The doctor's going to tell you exactly what the standard operating procedure is, and then you do it. Now, at times that might be absolutely necessary. The point I'm making is you really have no control. You're just basically doing what the doctor says to do. Where in our world, if we can teach you how to take care of your body better, what potentially could have caused this, what you can do to increase your chances of healing, right? You start to have more and more control. And when you have more and more control and you have more information, what happens up here is you totally calm down, right? You know you're dotting I's and crossing T's. But the only way that you can get to that place is by us educating you or you learning somehow. And that's why the cancer conversations are here. That's why I'm a part of the plan from early on in the process. That's why we have follow-ups consistently. That's why we have the people downstairs that we have, because we want to make sure that, not to use this in a derogatory sense, but we hold your hand through every step of the process and teach you almost day to day what you need to know in order to say to yourself at some point, wow, I feel like I have a plan. I'm no longer the quarterback. Somebody else is quarterbacking this that I trust. They've looked at all the data. They've dotted every I. They've crossed every T. I can just show up and heal. Ladies and gentlemen, the feeling of getting to that place, I can tell you personally, going through an experience years ago, that I wish I had this type of plan. It would have made me feel so much better and more in control, because when I was diagnosed years ago, I had none of this, right? So as somebody who's wasn't very, how would I put it? I was very nonchalant. I felt invincible. I didn't worry about things. I was an athlete. I took care of myself, and I thought I was invincible. I get diagnosed with melanoma at 28, and every day after that, for a good while, every little lump and bump, and if you've been diagnosed, you know what this feels like. Every little lump and bump I was worried about, and I'm somebody who never worried, right? Even going to the doctor, I will tell you this quick story. My wife called me the day that I was supposed to go to the doctor, and I told her I can't go, I'm too busy, it's nothing. And she basically told me, hey, you better go or else. So I went, you know how that works, right? So the point I'll make with that is I was so nonchalant and so like, no way, that I feel like if I was like that, then I know what you all are feeling, right? The point I'll make with that is with a good plan, right? A step-by-step plan, I wish I would have had it, because it would have calmed me down significantly, knowing that I had control and I could do things to prevent this from coming back, okay? And that's what the part of the plan is for. The purpose is to make you feel at peace, make you feel in control, make you feel less anxious, that you know you're dotting I's and crossing T's, and you also know that you have help here, you know, from the doctors from this clinic to guide you through that process, so you don't have to be the quarterback. And that's what the 4 pillars do. So it's all the testing that we do, right? It's the starving of the cancer in pillar 2, starving the cancer with potential repurposed drugs. It is the killing of cancer, and that could be chemo, surgery, radiation, immunotherapies, low dose chemo that we do here. It could be some of the modalities naturally that we have, vitamin C, hyperthermia, things like that could have the cytotoxic effect on the cancer cells. Hi, Doc.
Hello.
Dr. Connealy, everybody.
Hello, everyone. Good evening or good morning or wherever you are.
Right. And so I was going through and giving them just the 4 pillar and wrapping that up. So pillar 3, we talk about immune boosting, right? A hallmark of cancer is definitely a weakened immune system.
Yeah, so I would say probably the number one.
The number one, right? And then we also see low oxygen, right? Oxygen's definitely a big factor.
Oxygen, inflammation,
acidity.
Acidity, because of the cancer. Otto Warburg got a Nobel Prize that cancer is a sugary, not because you necessarily eat sugar, it's because it's a defective metabolic disorder of a cancer cell. So your mitochondria, which are powerhouse engines of your cell, they protect us every day. And so if the mitochondria are being destroyed by stress, heavy metals,
toxins, infections.
Exactly. All those things damage our mitochondria. And so if they can't defend it, so they go into a reproductive cycle of anaerobic glycolysis, which is fermentation of sugar. And that causes acidity, which causes low oxygen. And so, and of course, this process just doesn't happen like in a day. It happens over hours and days and months, because people always go like, oh, wow, I have cancer, but that cancer started about 10 years ago. So your immune system is in charge of, destroying these cells, right? These bad cells that we're making, because we all make cancer cells every day. So we have to have this astute, awakened immune system that destroys these abnormal cells and keeps us in check. But when we're overwhelmed by all of these things, stress and toxicity and inflammation from all of these things. And so people always goes, oh my gosh, this is so much. Well, the miracle that we live in every single day, it is a miracle. And we have to steward this miracle so that it works for you each and every day. And we here are trying to educate you, inform you, support you, guide you, and we all have to open mind to everything that's going to help heal us. Yeah,
and that's so that in that pillar 3 that we talk about, it's the cell, right? It's everything that happens to the cell that we want to reverse as quickly as possible. So a lot of you will come in, if you've been here, you know that day one, the standard for the most part to start is going to be oxygen, alkalizing, immune boosting, increasing voltage of the cell, looking at the nutrition levels within the cell. We talked about that with the oligoscan. And so if we get started there, but then can do the labs, right, that can refine the process more and more and make it more individualized, that's where we start. We start with a standard plan just because that's what's happening in your body. We know that, it's proven. So we want to reverse that as quickly as possible. And Dr. Connealy alluded to that pillar 4, which are the root causes. You know, it's kind of like peeling back the layers of the onion. And there's as you say, a tornado, a hurricane,
and a rainstorm.
Rainstorm going on in the body at one time. And that is everything from infections, potentially. It could be bacterial. Viral loads are very big in this. Epstein-Barr is a biggie. We could have candida. That's a biggie. Parasites are a biggie. Heavy metals, toxins. You talk about phthalates a lot now, and BPAs, which are the plastics and things in the environmental toxins that we see. We want to look at all those to see if any of those quote-unquote antigens or foreign invaders are in the body causing damage to the cell, like Dr. Connealy was saying. So just generally speaking, that 4 pillars of all the testing and the starving and the killing and looking at the immune system and oxygen and alkalization and all that, plus looking at the causes is, now there's a lot of detail to that I'm leaving out. But what I'm saying is big picture, 30,000 foot view, that is the plan. And if we're doing that and we're doing it very, very detailed and crossing T's and dotting I's, that's where your upside, right? And that's the idea. We're just trying to increase your upside as much as humanly possible by applying these things that we know.
Right, because the thing that in the conventional world, their intentions are good to do surgery or chemo or radiation, some combination.
Absolutely.
But we must change the terrain and the garden of each individual cell that Dr. Roney was talking about. So if all the cells, they all work in a community together, okay? They don't work in their own world. Right. They all work in a community in harmony. It's like an orchestra going on every nanosecond of your day. And so you have to get all those cells working together to take care of you, because the cells make up a whole, which is the whole entire body. And if you do a biopsy, let's take a biopsy. It's an injurious immunosuppressive process. If you do surgery, it's a very injurious immunosuppressive process. If you do chemotherapy, it's a very, very powerful chemical that's destroying cancer and your normal cells. And then you do radiation, which also damages normal cells and the cancer cells. And any one of those things may be necessary, but we have to develop the collateral support protocol for you, that you have the best upside, okay? And so, because cancer isn't something you negotiate with, you know, it doesn't work like that, because you've got to have at least a lot of different things in your back pocket for this disease, okay? And our system should be a preemptive preventive precise system, but it's not. We're going in the era of wellness and well-being, because you can tell that by all the health podcasts, health shows, health Instagrams, all the things. And then these young people that are getting cancer, they're seeing that we have to change the paradigm, because how can they be 30 years old and sick already? Okay. Right. Or 25-year-old and sick. I mean, today I was going through the medical records of a potential new patient, because I usually look at the medical records to see if they're a candidate that we could really adequately take care of them, because some of these patients come in with very, very extensive disease and they've already had lots of treatment elsewhere. And so we want to make sure that we can properly help them.
And we're fair. Yeah, we're fair.
And so I looked at this young man's chart. He's 45 years old and he already has esophageal cancer. And I'm like, what? Like, that's a disease you find in much older, 30, 70-year-old, 75. And I was like, what? So I'm looking all these cases that I'm seeing. Most of the cases are less than 50. They're 30-year-olds with brain cancer, and this 45-year with esophageal. I went, what? How can this possibly be? And I have a history. I've been doing this for 37 years. I've never seen what I'm seeing now.
Yeah.
So we all together need to get informed, educate ourselves, read, be really outside the box and open to everything there is out there to learn and to solve. Because together, all of us, like today I did a podcast at lunch, and this young girl and her partner started a podcast, and they started it because of their own health problems. And I do a lot of that now because these young girls have health problems. So they're like, no, we got to educate everybody. So that's what's happening. And that's what we see in our young patients. They want to help transform the future of their babies.
Yeah.
Because we cannot continue on with 1 out of 2 being cancer diagnosis and spending $4.3 trillion on healthcare, soon to be 5.1. We can't do it.
With being one of the least healthiest nations in the world,
right,
with spending 2 to 3 times more
than any other country. So obviously everything we're doing, if it were working, I'd be, wow, this is great, I'm excited.
Yeah.
But nothing is working, and I don't want to say nothing, but a lot of the system isn't working. So we've got to completely, change. And I know a doctor contacted me this weekend. He was introduced by someone that I wrote for his publishing company before. And so she goes, oh, I want to introduce you to this concierge doctor. He's really interested in, integrative functional medicine. He's been practicing for 20-some years. And then he said during COVID, he had a complete wake-up call. And now he sees all the deficiencies and the defective trajectory of conventional medicine. Yeah. And because I said, how did you decide?
Yeah, right.
You're a conventional doctor, so forth. He was a director of different places here in Orange County. And so now he's he wants to come learn with us now. And so I'm like, thank you. Gosh, we need more doctors like that. And it is happening, but it's slow, but you guys can be the change. You guys are all helping us. And the more that you share and spread this is how we're going to invoke change. Yeah. So I really appreciate you guys being part of our community, because that's how we're gonna turn all this around.
No, I agree. And we talked about this in the 2024, the cancer conversation, what we'd like to do. Cancer, longevity, cellular health, human optimization. We want to make sure that we're doing a better job. I went over the personalized plan that they could come here for wellness.
Oh, good.
We're going in, and I know I said this, so I don't want to be redundant, but I did want to parallel what Dr. Connealy is saying. What we're seeing in clinically is leading us to go, oh my gosh, we have to do such a better job on the wellness side, and teaching wellness and being aware of these root causes and what's happening at the cellular level. That's really where my passion comes in. I mean, I love doing this, but I really want to start teaching cellular health and what they're learning, what you're seeing, and what we're able to teach, so then the communities can start doing things on their own to change their own cellular health for longevity, disease prevention, all those things. It's at that state of almost, I don't want to say emergency, but we're pretty close.
We are.
We're pretty close if we're not in that emergency type. I'll throw one more stat out there that I was reading the other day. We consume about 66% of all the pharmaceutical meds in the world. And we're about 6 to 8% of the population total.
Right.
How?
Yeah.
Right? So as Dr. Connealy was saying, these stats and these numbers tell you that what we're doing, not our opinion, statistically, objectively, isn't working well. Right. So we have to start changing that mentality and the paradigms, and having the conventional model, in on that too, and start understanding.
Right, because the doctors and the ERs and hospitals, they're not quite at all with the program. Otherwise, they'd be doing this.
Right.
And the oncologists, you see, that all the oncologists know what's going on. They're seeing it. The patient's sitting in front of them.
Right.
But they're not letting everyone know, saying, oh, we got to do something. And so I know there's other doctors that are similar to us trying to do that too. Just not enough of us. The tribe isn't big enough. It's growing, but really, really slowly. And so I just feel like the patient has to change the system.
Yeah.
And you've
and
got
demand and dictate.
demand.
Yeah.
Exactly.
Yeah, for sure. And that's how it works.
Yeah, that's how it works.
If we all cry loud enough, right, and hold our breath long enough, they'll start to acquiesce a little bit to the demands, and they'll have to, or else that paradigm and that money making machine, if you will, won't be as fruitful.
Right.
So they're going to have to change as a result of it.
Yeah, because no one's making money. I mean, maybe the pharmaceutical companies are making money, but the patients aren't winning. That's the problem.
Agree 100%.
We're, like today, one of our patients she's brand new with us. She was diagnosed with 48. Well, she was probably 46 when she was diagnosed with colon cancer.
Right.
Stage 4. She did chemo, and then she got a clean scan and thought she was fine, and her doctors thought she was fine. And now, I mean, when I read the scans, it was definitely back. They just didn't tell her. So we told her, you got to go back to your doctor. It's there. Order another PET scan. And sure enough, so now they want to start chemo again. But we can't. You got to try to do things preemptively as much as possible. Yeah. So
the less times you use chemo, obviously, the better, right? Because the sensitivity reduces and so forth.
Exactly.
So that's where we know that. So when we get into, treat the cancer itself, and that could be, I call it the bomb. It could be a surgery, a chemo, a radiation, what have you. Sometimes that's absolutely necessary, and Dr. Connealy will attest to that fully, right? It depends on what's presented. And that might be part of the answer. But the other chapters in the book, I call it, that's one chapter. The other 19 chapters are all this to change the environment so the chance of it coming back decreases significantly. Right? That's the idea. So that's where these pillars come in. And that's why I tell you, the plan is what I believe in fully, because I see it work every day.
Right.
If it's followed properly. Right? So anyway. Okay, so ready to jump into some questions?
Yes.
Yeah. Okay, so we have some that were sent in previously. We'll try to get through these, and then the ones that are up on the Q&A here, we'll try to get to those as well. So I'll let you.
Okay, so.
You want me to read the first one?
Yeah.
Okay, so I just found out my lower right lung lobe has a 2-inch tumor, and the nearby lymph nodes look affected too. I haven't got the biopsy back yet, but will soon. Nonetheless, I'm curious, how would cancerous lung tumors be treated by your team? Cryoablation, ? Insulin potentiated therapy, ? What else? As you can imagine, orthodox oncology might want to push me in only one direction. So I really need to feel hopeful and know that there's as many options as possible.
Right. So that's a great question.
Yeah.
So the first thing is, we don't know what kind of cancer it is. So it's in the lung. Is it primary lung cancer? Is it colon cancer metastasized to the lung? Is it breast cancer that's metastasized to the lung? So I'm not sure what your primary was, or is the lung the primary? So we know that we have to get the pathology specimen, and that will direct our treatment, like what is the best treatment for someone once we get the biopsy back, because they'll determine what pathology it is. And then, yes, we do insulin potentiation chemotherapy. We call it fractionated chemotherapy. So you may be a candidate for that. I just don't know you'll have to let us know what your diagnosis is once you get the biopsy. Mm-hmm. And then we have been doing a lot of cryoablation. We do cryoablation with, I personally have had experience of doing cryoablation with breast cancer. And so one time when I had a patient from Texas, he had a bladder tumor. So I asked the doctor who was doing cryo, I said, "Oh, do you ever do cryo of bladder tumor?" So she said, "Yeah, I'll try it with immunotherapy." Mm-hmm. So I was like, "Oh, okay." She did, and it worked. And I was like, "Oh, this is great." Well, now, fast forward now to 2023, we knew about a doctor, and we'd been trying to set up meetings with him so he could do an in-service with our doctor group. So we did an in-service with him, and he's an interventional radiologist. So an interventional radiologist is a radiologist who can do invasive procedures. He or she doesn't just read chest x-rays and PET scans and MRIs, but they go in and do procedures. So this particular doctor will do cryo, which is freezing, and then he will instill 4 to 14 different immunotherapies into the tumor itself, and then it creates like a vaccine effect to the other tumors. So anyway, so we've been utilizing that procedure in the last, 3 months.
A few months, yeah.
Yeah. So anyway, so that is an option, and so, but we'd need to look at the case completely, like exactly what else is going on. And she's waiting for the biopsy back.
Mm-hmm.
So we'll determine what your best treatment course is based upon the pathology results. But again, we're just talking about the icing of the cake of fractionated chemo and the
it's one part of
the equation.
One chapter of the 20-chapter
so
book.
We have to get your foundation, and we got to make sure that all your cells are in harmony and working together as a team to take care of you.
Yeah, I think one of the things that I'll add to that is sometimes I feel like, just feedback, and it's my opinion, in the conventional model, they just go, oh, well, you have this, we'll treat it. But the question of, well, why did you get this and how did this happen? I think they're just like, we don't know. I'm not sure. I'm kind of making judgment here that they just go, yeah, we don't know, so we don't address that.
Right. So
yeah, go ahead.
And I'm glad you brought that up, because the key thing is why.
Yeah, right.
Why do you have this? Whether it's cancer, hypertension, heart disease, diabetes.
Right.
Why do you have it? Not we're going to just treat it, but why do you have it? You didn't have it last year, so why do you have it this year? Mm-hmm. So the doctor or the practitioner needs to go in. How do you live? What's your stress level? Do a complete deep dive and go down the rabbit hole. Why, where, when, and how do you have this label diagnosis?
Yeah.
And so, and unravel that, because I had a patient who's a judge. He'll be 81 in January, so he's conventional, going to conventional doctors, history of prostate cancer, and he's on a statin drug, a blood pressure drug. His PSA is being controlled, and then so I said, well, how long have you been high blood pressure? Well, they just gave me this medicine and I just took it. And I said, well, why would you just take? Why wouldn't you want to figure out why? And so just with me, he goes on hikes with my husband and comes over for dinner because he's a neighbor. And I said, just get off the blood pressure medicine. He got off the blood pressure medicine. He got off the statin. He's off all his medicines now, and he's 81. Just by making changes in his eating and just everything. And, now he's a patient and, he's 81, doesn't need meds, he's fine, everything. So, but it's like all of us should be asking, why is this happening? Mm-hmm. Okay. Like if you don't sleep, well, what happened? What changed in your life that you're not sleeping now? Mm-hmm. And so we are trying to understand the why. Yeah. And so I know in the conventional world, they don't ask the why.
Yeah.
So
they're not really taught, to go down that thought process.
That
That's
investigative
the
pathway.
Yeah, they're just like, oh, it's just the body, this happens.
This happens.
Right? And I will say, I'm going to add one thing to this, because this was taught to me years ago, and I really feel like this is an important concept. There's common and normal. What the doctors see, or what you might see around you every day as far as people in ill health and degenerating and aging rapidly, that's common, but that's not normal. And in the conventional world, they'll just say, oh, Mary, you're just getting older, right? That is not accurate. That is common, but it's not normal. So don't ever accept what they're telling you as normal. It's not.
Yeah.
And that's a biggie for me. That was a big deal for me to learn.
Right. And that's another thing that, I thought about it this weekend. I've read now, okay, the life expectancy has now gone down 4 years in a row. And I'm like, Well, why?
Yeah.
Why is this happening? Why
With
aren't
all
we,
the technology.
Yes,
with
and why
everything.
aren't we saying, why is this happening? We need to do something. The first year we should have
Yeah,
said,
right.
wait, we're supposed to be getting smarter and better and more technology, but our life expectancy is going down. We should be saying, how do we increase our life expectancy? That should have been asked the first year it happened, and
Sure.
it didn't.
Right.
I mean, other than like doctors like us who are
Sure.
are trying
We're
to
still
make,
the exception.
yeah, like
We're not the rule.
like one of my patient tonight, their husband and wife, he's 81, she's 80. They're just here for human optimization. He's fine. They're both fine, doing good. I just told them they need to walk an hour a day. They were kind of like half-assed doing the exercise. And so, but I'm like, they're fine, because they've been coming for 20 plus years. All right, let's answer the next question.
You got it. Are parasites a precursor to cancer and other ailments? This is a great one. Dr. Connealy really hit this one out.
I love the whole thing because it's interesting. I'll tell you about my history with parasites. So I remember I had a gentleman who worked for me. This had to been, I don't know, 20 years ago or so, 22 years ago. So his friend was a gastroenterologist in Los Angeles. So we all went out to dinner, and he was the only doctor educating other doctors at the American Academy of Gastroenterology on parasites. I go, oh my God, I need to learn everything he knows. Because I'm like, we didn't learn anything that much in school. So anyway, he tells me, okay, you need to do this stool test. This is a great drug, and da-da-da-da-da. Okay, well, that started with that. Well, now we went from that to like becoming pretty expert on parasites. There's hundreds of species of parasites. People think that parasites didn't exist because I'll be honest, when I went out to dinner here, parasites never came across my radar.
Right.
Okay.
For sure.
And now it's like, well, it comes across us every day,
Mm-hmm.
And so parasites are real. They are happening all over the world. Very difficult to diagnose, okay, because a stool test won't discover all the species of parasites, or they die before the lab tech gets to it to analyze it. So just because you had a stool test and it comes out negative doesn't mean you don't have parasites.
They burrow in the digestive wall. I mean, there's a lot.
Or they
of
live in the pancreas, or they live
right.
in the liver, or they
right.
live in the brain. They live in other parts that they don't even go through your stool. So you're going to have to. So we have several different ways that we find parasites using the F-scan and bioenergetic testing. That was actually discovered by an internist out of, I think he's in Missouri, who's a Chinese, he's a Chinese doctor who's an internal medicine doctor, but he determined how to, discover and treat parasites. And so we learned from him too. And I think he's been doing that for like 25 years. Anyway, so now, parasites are a real problem. They are a precursor to cancer because it's another form of chronic inflammation. Mm-hmm. So any infection, just imagine the last time you had a cold, how terrible you felt. Your whole body was inflamed, and just imagine your body being inflamed all the time if you don't get rid of those parasites. Mm-hmm. And so you don't feel good. You can have brain fog, you can have abdominal bloating, you can have diarrhea, you can have the opposite, constipation. But you can have so many different complaints because they're parasites. They live off of you, so you don't feel good. Mm-hmm. And I personally have had parasites. I'm on a continual parasite prevention protocol.
And I'm not sure we all shouldn't be, but I'll throw that in there.
Because I seem to get them easily. And so I just stay on a prevention protocol because I don't like the way I feel. I don't feel well. One of the biggest complaints I get is fatigue. I get brain fog. And so I just know, and I just do a prevention protocol. But if you look at the rates of cancer in India, twice a year, in February and August, they give the entire population fenbendazole, which is an anti-parasitic drug, and they have lower incidence of cancer in India than we do, like dramatically. Well, I'll bring up the next time we have a cancer, I'll bring up the slides.
And mebendazole, some of these anti-parasitic meds are also considered repurposed drugs.
Yeah, they're
because
anti-cancer.
They're anti-cancer. They can block certain pathways.
They interfere with the microtubules of cancer. So that's how they're very effective. So you're getting rid of cancer and you're getting rid of parasites. So parasites cause chronic inflammation, chronic disruption in the functionality in your cells and in your body.
And if you're combining that with other infections or other toxins and chemicals, the same reaction is going on, right?
Right.
So the inflammation, as you remember I said, one of the keys to this whole thing is inflammation, will start to damage via the free radicals, right? We'll talk about that at another point, but it'll start to damage the DNA and the genomes of the cell. And those DNA and genomes are responsible for apoptosis, which is cell death. Enough inflammation damages those. All of a sudden, these cells that are damaged and old, that are supposed to die off, don't die off, and they replicate. And essentially, I'm leaving a lot of steps out, but that's cancer.
Right.
Inflammation drives that.
Right.
So whether it's parasites, a combination of parasites, infections, other infections, bacterial, viral, you start to layer those, and all of a sudden the body it gets overwhelmed. And I would think that that's personally what I think is what's happening. That's what's happening in the world today. We're just bombarded constantly
thousands.
with inflammatory type of agents.
Yeah.
So identifying and removing them as much as we possibly can gives your body the best shot.
Right.
Is that fair?
Right.
All right, so let's, what preventative steps can be taken for pancreatic cyst in the head, which biopsy determines to be a high cancer risk for cancer? A Whipple has been suggested, a path I would like to avoid.
Well, you're a perfect patient for us for prevention. I know exactly this. One of my girlfriends, she did a national charity league with me with my daughter years ago, and she had exactly this. But I've had several patients have exactly this. So a cyst may not be cancer. It may, though, indicate cancer. So what I would do in this case is, first of all, make sure your hemoglobin A1C, which is a reflection of your sugar over 90 days, make sure the doctor's done a really good, thorough laboratory deep dive testing on you, and I don't know how old you are. And it doesn't sound like you have pancreatic cancer from looking at this. And like we already talked about, parasites may even be causing, because if you look up pancreatic cyst and parasites, you'll find plenty to read.
Same with liver. Liver's
yes,
like that
liver
as well.
cyst too. So a Whipple is a big procedure to remove your pancreas. And we don't know if we even need to do that. And obviously, you want to preserve your organs as much as possible. Obviously, if this were pancreatic cancer, they would do surgery, but I don't think they've even determined that. So the marker for pancreatic cancer is CA19-9 and CEA. I would do those two markers. So you need to get evaluated completely by us, because I don't have enough information. And you have, I don't know if you've done biopsy. And that's a delicate procedure. We have use a very protective protocol before biopsy. So I would handle this very gingerly, because your pancreas is a very delicate organ.
Big deal.
And it's a big deal. So I would, I would recommend that you see one of us so we can really get you a path of good healing.
Yeah,
So
agree. Okay, so this is a good question in general, because it does tie in. Can you please talk more about autoimmune? If someone is taking Rituxan infusions every 6 months for neuromyelitis, optica, what could your center do for them?
Well, it's the same thing we've been talking about. So if you have autoimmune, which you shouldn't have autoimmune, because none of us should have autoimmune, it's why. Why do you have autoimmune? Something happened. So the year before you had autoimmune, you were fine, right? And now you're not fine. So you need to now discover why your body is going against itself. So that's what autoimmune disease is your body is going against itself. Well, your body's not designed to go against itself. So you have offending agents, whether it's chemicals, whether it's chronic infections, mycoplasma, parasites, bacteria, yeast, everything, heavy metals, all these things that we're all exposed, and we're all at risk. It's not like you guys are just at risk. We're all at risk, okay? So you've got to take a deep dive. Now, the Rituxan's just inhibiting your immune system to react.
Right.
But the downside of Rituxan is it's damaging your immune system, and you have increased risk for cancer with these drugs.
Yeah.
So you need to unravel why you have this neuromyelitis. And I don't want to forget stress, it's, I would say, everyone's number one, thing is chronic stress. Yep. So we always have to address the causes. One of the causes, which is stress. So
gasoline being dumped on the fire, right? To put it mildly, if you have this fire brewing in your body and the fire is that inflammation and your immune system overreacting, there must be gasolines being dumped on it. There has to be fuel that's going to spark that fire. So us or somebody looking through those fuels and then balancing the immune system better. There's things just to get into vitamin D and glutathiones and your turmerics and resveratrols. There's certain things that you could pour water on that fire, but the reality is we have to get rid of the gasoline that's stimulating the fire, and that's what Dr. Connealy was alluding to. Okay, so let's see. Do you know Dr. Keith Block? Are you familiar with his methods and so forth? Do you know anything about them?
So Dr. Keith Block, I know he does more integrative oncology in Illinois. And I think, he incorporates very similar to us as far as he'll do what they call metronomic chemotherapy, and he will do natural substance and everything. He probably doesn't do every single thing like what we do. If you've been tuning into our cancer conversations, we check voltage and all the other great things that we do. I look at your blood under a microscope and all that. So he may not do all those things, but he at least is, combining the best of natural treatments with conventional treatments of chemotherapy. So he might be a good place to start. So, and he's talking about the behavioral and the IV nutrition, all that. So I think, I know of him, I know what he does, and there's some similarities.
Yep. All right, so the next one is how long will it take to recover from my biopsy, possible collapsed lung? Some say days, others say weeks. Locations, hilum, lower right lobe, days, weeks to recover.
Right. Well, it's going to be probably more like weeks or months because it's, you're invading the body. And so it looks like you're talking about the lung, so you're going to do a bronchoscopy. And so you need to be on a proactive preventive protocol and an anti-inflammatory protocol. And I'd probably be doing IV vitamin C along with it before and after, some hyperbaric before and after, create healing, do modified citrus pectin, make sure you have omegas on board, high dose vitamin C, pancreatic enzymes, and something to alkalinize your body, pH adjust. So all those things too, and make sure you do really good deep breathing exercises. You want to do like the Wim Hof, or some, there's a lot of breathing exercises online on YouTube, but I would definitely be doing breathing exercises, probably twice a day. It's good to do if, let's say you don't have to get a biopsy. Breathing exercises are great to do. So look up on YouTube, Wim Hof. There's a great 10-minute breathing exercise that it would be good for everyone. Mm-hmm. There's a great book called Breath that also explains the beautiful nature of your lungs and why the breath is so important and it keeps you alive. Mm-hmm. And you learned a lot of that when we had COVID. Mm-hmm. So it would be good for everyone to do. So, and we don't know, it depends on how the health status of yourself, of how you recover. And so you want to try to be in the best state possible when you even get a biopsy. And so, we talked about the things that would optimize your recovery the best.
And that's here, when somebody goes for a biopsy and we're aware, or they go for surgery and we're aware, or they're doing radiation and we're aware, we have protocols prior to and during for every one of those different things to make sure that you're mitigating the downside and maximizing the upside of healing. And we're just using general strategies of detox or oxygen or immune boosting or different things like that that are going to make a significant difference in your recovery and your turnaround time. So,
right.
Big one. So those protocols are significant. Okay, so do I really need a biopsy? This is a good question. I'm scared of the potential pain. How soon should I get it? And then can it cause cancer to spread and cause permanent lung damage? So the big one in there that I get all the time is, can it create seeding? The term seeding, where if we open this thing up, can it go places? What's your thought on that, Doc?
Right. Well, and I talk about this in my book, The Cancer Revolution. And, if you go online, there is the potential to spread a cancer when you poke the bear.
Mm-hmm.
Okay. So a lot of doctors deny this, but just think about it. You have a balloon, all right, and you put a needle in it, things happen. And that's why we have such a preparation protocol for that, is because to prevent the inflammation, the seeding, and have a killing effect already in place when you do a biopsy. Mm-hmm. So, but if you go online, there's plenty to read about the potential, because it's anytime you have an inflammatory process, you have the potential for cancer, and I've had patients have biopsies and they go, oh my God, now, it's the breast is twice its size since I've had the biopsy. And, the lung is a tricky area. Mm-hmm. It's a very tricky area. And so you want to take the proper precautions, like I said, and unfortunately, do you need a biopsy? Some doctors will be conservative and say, you know what, if you just want to watch it, you'll have to talk to your individual doctor and say, is this okay if I, just repeat a CT scan in 3 months? And I don't know the particular condition here. What are the other confounding contributions right here to this particular situation? So I don't know. Is it because you had cancer before and now there's a lung nodule? What was the lung nodule before the prior scan? I mean, all these things. So I need a lot more information before I
give you
take a absolute direct pathway. And it says, I am scared of potential pain. I agree with you. Mm-hmm. But there is possible pain when you do something. So so taking curcumin prior, because curcumin is anti-inflammatory and anti-cancer, so that would be a great thing to take a big dose before and after for pain and inflammation and cancer. So that's what you could take as a preventive for pain.
Yeah, and one of the things that I think the kind of common sense that I would recommend too, for people that are worried about spreading, talk to the doctor that if it comes back a certain way, say it comes back positive. So say somebody has a lumpectomy, it comes back positive. Talk to the doctor about, okay, what would you do then? That way you kind of have an idea maybe of the next step, so you're not waiting too long for when you poke the bear, for it to do some things. That would be just a question that I would ask. Okay, if I do this biopsy and you find this, what would be my next step? And try to do a little due diligence ahead of time as to what you feel comfortable with. And then you say, okay, if that's it, I'm going this direction. Family member, you're just using a family member. The lumpectomy came back positive. She already knew and asked the surgeon, okay, tell me the percentages, tell me what this would do, tell me what that would do. She felt comfortable that once the biopsy was done, that if it was positive, she would schedule the lumpectomy literally the next day. So there was no chance of major seeding, if you will, or spread, because we had the steps down, in order.
Preventively and proactively.
Preventively, yeah. So
so I just tell people, always err on the side of caution for everything. This is just what we have to do. Now that we know we can do all these things, it's like, why would you invade for example, I had back surgery. So I researched everything to have the best outcome of a surgery. Mm-hmm. So 3 months in advance, of course I get scans and an echo because it's going to be like a 15-hour surgery. So I go and get full body imaging and echo and chest x-ray and everything. And then I did mental work. I did hyperbaric IVs for 3 months before my surgery. And then I did it after my surgery.
Mm-hmm.
So, I wanted to get the best outcome. Yeah. And that was not even for cancer. That was just for the scoliosis.
Yeah.
So I believe in doing as much preparation as possible for any health condition. If you're going to go get a CT scan, if you're going to go to get a PET scan, if you're going to go get anything, do all the collateral protection for your body. Mm-hmm. And we should all be practicing like this. This is not something, right. It should be every
day. It should be commonplace.
It should be a common thing. Yeah. So.
And by the way, prior to you doing surgery, you literally did everything for years to not go down the surgical route as well.
Exactly. So I was
she did everything.
Yeah. I was diagnosed because I never went to the doctor when I was young. So when I go to my college physical at 18, the doctor goes, "Oh, you have scoliosis." And I'm like, "Oh, well, I didn't know anyone tell me." And I mean, this was years ago, and they didn't have the screenings like they have now. So I was young and going on my life and all that. And then I got pregnant with my first child and I was 34. And then I had twins at 38. And that's when my back kind of got worse because here I have 45 pounds and my pulling lots of pressure and stress on my back. So my back got worse. So then I was busy raising my kids and, doing the best job taking care of myself. And then as I aged, my back got significantly worse. So I started doing Prolozone. I saw a chiropractor and I did something called the Clear Method, mm-hmm. where you do these intense for 2 hours. Each treatment mm-hmm. was
straightening.
Oh my God, so much. It was I did it for 13 months. I got like 10 degrees of improvement, but I just hit a mental block. Yeah. I wore braces. There wasn't anything I didn't do, guys. Okay, so it's not like I haven't been on my own discovery journey on how to do things. And I mean, I spent time, money, energy, hundreds of thousands of dollars going to see and get things. And then finally I'm 60 years old and I go, I'm not getting younger. If I'm going to need to do surgery, I guess this is the time. So I went and consulted with one of the best guys in the world, and that was in Germany. I did a Skype. At the time it was Skype. We didn't have we didn't have Zoom like we have now. And the doctor was an engineer and he was an engineer first, and then he was a mechanical engineer and then he became an orthopedist. And he was close to my age, so he's had a lot of experience. So I said, okay, can I call 5 of your patients? They gave me names. The first person I talked to, she goes, "You're lucky. He's alive and you're alive at the same time." So I talked to his patients and they all, were, so complimentary of him. And I went to Germany to have 14 hours of back surgery. This was 4.5 years now ago. And then I had to go back 3 months later and have the, 4 more hours of surgery. And so, and do I still deal with things? Yeah, because now I'm 66 and, you're always there's no finish line to health. So, but what I'm saying is I knew I had to do surgery, but I didn't just go, I'm just going to go do surgery. I prepared myself for the surgery because I know, and it's not like my first detour in life. I've had many detours in life. So I've had plenty, and I always go and research and educate myself and talk and try to find what is the best plan. And that's what we're trying to do here, is constantly looking what is the latest, greatest that we all need to do to take care of you. So with that.
Right. Yep. Next question is about hemangiopericytoma, brain tumors, currently stable, under age 45.
So again, the hemangio means it's a blood vessel, okay? and blood vessel wrapped around a cell. So again, I mean, I'm glad you're stable. So again, it's like, what is the origin of this issue? And I'm not sure if you had surgery or, what, you've done to know. But I'm not sure your question, but, with brain tumors, we do see, unfortunately, a lot of different kind of brain tumors. But again, it's like with anything, it's removing all the offending agents and then finding the best targeted treatment for this particular situation. So I know I didn't really answer your question because I don't know, I need to know, yes, what did you do? Did you do surgery and that was your treatment? Did you do Temodar, which is a chemotherapy? Did you radiation? What did you do? And then how are you, if you're just monitoring it, the MRIs, what did you do to understand why you got the brain tumor? So we know that cancer is about a 10-year disease. From one cancer cell to tumor is about 10 years. So what did you do? What brought this up?
Yeah.
You got to look at electromagnetic fields. You got to look at your job. You got to look at, we talk about parasites. They do have mold, heavy metals, all these things that, to see what your terrain is. So, and really figure out, everything. There's repurposed drugs we use for not just brain tumors, but cancer in general, because there's some significant ones, especially like for glioblastoma, can tremendously help the growth of those cancers. So, I would
full evaluation. Really, honestly, it's a tough
exactly.
one. Okay, most effective natural treatments, and specifically if at-home sonotherapy is recommended, i.e. full spectrum infrared, far infrared, ? Some saunas you can buy are walk-in units, some are zip-up, body-type pouches, you sit in with your head outside. I've heard conflicting info about protocols and the effectiveness of them. Please elaborate.
Yeah, so infrared sauna, so we've had an infrared sauna in the clinic for probably 25 years at least. Okay, and so infrared therapy, first of all, sonotherapy is nothing new. So the Norwegians are the ones that have the best studies, and so I don't mind if it's, in the enclosed, head enclosed or the head out. I think that infrared sauna is one of probably the best investments you can make in your health, because of the overwhelming amount of toxicity, not to mention the healing wave of energy of infrared is very powerful, and it helps neutralize EMFs, it helps get rid of toxicity, it helps your circulation, it turns on your heat shock proteins. I mean, it increases your circulation, great for cardiovascular, so many things. In fact, there is nothing. The Norwegian studies show that if you do infrared sauna at 170 degrees for 20 minutes, 6 days a week, you reduce your mortality 50%. There's nothing that does that.
Yeah.
So it's probably the best investment. That you talked about pouches and everything. All the studies were done on a sauna, so not on a pouch. I do know they do have those enclosures. In fact, a patient of mine just did this treatment, heavy duty hyperthermia. So anyway, I just think you can't go wrong with getting an infrared sauna.
Yeah, so. And I would invest personally in the enclosed, right? I would invest, right. I personally would. I don't know what you think, but
it's more comfortable too.
It's more comfortable, and it's not, I don't think they're outrageously expensive personally. No. You probably get a good one, $2,500 maybe to $3,000.
My original sauna that I have, 25, it still works.
Yeah.
My husband's had to change the electrical circuit board, but other than that, it's still very effective, and I've never had one of them. If they broke, I just replaced the little circle thing, and it's working. So.
All right, good question here on the Gallery test. By Grail and liquid biopsy. We actually just had the rep in today doing an in-service. Yeah, an in-service for the Gallery test. But I'll let you. I have a couple opinions on it, but I'll let you.
Yeah. So fortunately here we have used lots of different laboratory testing, and so Grail test is considered, or Gallery test is considered a liquid biopsy. I don't think it is the best thing that I've ever used, okay, because so far the patients that I did it on, they've all become negative, okay, but I would not use that as my standalone test.
Yeah.
There's 2 other labs, like if you want to do a liquid biopsy, I've used our GCC for I don't know how many years now, long time, and then we just got introduced to a new lab out of India called Datar, DATAR. So I've done one of those already, and I compared it with RGCC and Datar, and they both came out with the same results. So that's only one test.
Right.
So I have to do like 100 of them to see where,
Right.
what kind of results.
Is it consistent?
Gallery?
No, I'm saying that's what you're trying to find out.
Yeah, because
is the
I
data
would not,
consistent?
if you were to come in, I wouldn't be doing gallery on you though.
Yeah, right.
I mean, yeah, I just wouldn't do it. I don't see yet the value of doing that over doing Datar or
right,
or GCC and your comprehensive blood testing and all the other things we do. I always tell people I don't use one thing to figure you out.
Exactly.
Because I wouldn't I don't ever see one thing as being the end all.
No.
I just think my job is to figure out as many things to use all the pieces of the puzzle. It's like you have a stained glass window, right? And one piece is missing. It's not right. So I always tell people I want to get as good a picture as possible, and I can tell that with everything. I mean, you can do whole body MRIs, for example, to look for lumps and bumps. But again, you could have cancer. You could have cancer and you think you're fine.
Yeah.
So those places are great because they'll tell you if you have something. But what if you want to really truly prevent? You'd want to do one of these other laboratories like RGCC or Datar, or we have a new blood test. It's not used for screening. It's called Signatera, but that's how we're following people with cancer now is Signatera. It was originally utilized for colon cancer, and now it's being used for all cancers. So I think it's become a very good tool to help us. And again, not 100%. Yeah. Because I've already seen where I know the patient had breast cancer. They haven't done anything, but their circulating tumor DNA is negative. So I'm like, oh, this is really interesting. And I had a young girl come from Texas recently, and she has the worst kind of breast cancer. So healthy and so everything, and she had the surgery. Her PET scan's clear, her Signatera is clear, and then she thinks she's fine. So I'm like, no, gosh, I don't know. This is right. Okay, she's so good. So what are they going to treat, right? So anyway, that's all brand new because the Signatera has only been utilized. We've only been using it for 3 months.
Right.
So I'm like, okay, this is interesting. She's like, oh, she's emailing me I guess I don't need chemo then. And I'm like, well, you have triple negative, which is the most dangerous.
Yeah, right.
I don't know if we'd make that decision. So anyway, every individual is an original.
Yeah.
We are all in of one, which means you're not like anybody else. And so we've got to now really be preventive, proactive, personalized, and precise about each person. Yeah. I know we like to, in medicine, it's okay, you have a strep throat, everyone gets this dose of amoxicillin 3 times a day. Well, maybe that's not the right thing. And now we know that isn't the right thing. Yeah. So, but that's what we tend to do is we just have this cookie cutter approach. And I don't like that approach because it doesn't work. Right. It doesn't work for everyone. It's not the best scenario for everybody.
And I think using all the tests, to your point, it kind of paints a picture.
Yes.
Right? And you want to use these tests. I'll use a quick example. Take me a minute. I had a patient that came back after their year. They had the lumpectomy, had radiation, totally clean. Everything was good. Liquid biopsy good. Cancer tumor markers good. We redid a year, and the RGCC, the liquid biopsy, came back at around 2.5. So something potentially going on, right? So then what we did with that is then we retested all the cancer markers, all of them came back clean. We did the Gallery test, came back clean. Did the Signatera test, came back clean. So the point I'm making real quick is we used that, but we used it in conjunction with a bunch of other tests.
Right.
And by the way, the Gallery test tests 50 different cancers, right? And they use it, there's a method they use the methylation within the cell.
Methylation pathways.
Yeah, the pathways to determine certain things. So again, it's not a standalone, nor is any test that we would do. We want to look at everything collectively to paint that picture and then go, oh, or ooh, right? And that's just, I'll make that point and kind of move on. But
right.
It can be helpful, but maybe not standalone at all. Okay, best things you could do besides taking lisinoprol if you have protein in your urine. Would some kind of enzymes work, or are there other supplements or treatments that you know of?
Yeah, well,
Kidneys.
that's a great question. So that's kidney, and
GFR.
kidney disease is exponentially growing, meaning there's stage 1, stage 2, 3, 4 kidney disease, and you should know your eGFR, which is estimated glomerular filtration rate. Look at your BUN and creatinine on your blood work, and you're estimated. So your eGFR should be about 100. And if it's, going down, and if it's in the 60s, you're already in renal failure. So, and as a consequence, some people can have proteinuria. And so they give you the blood pressure pill, lisinopril, to preserve your kidneys. But what you have to do is you got to take care of your kidneys.
Yeah.
So I would be putting you on kidney drainage formulas. I would have you do infrared sauna to get the load off the kidneys, all the toxins, and everyone is loaded with them. Trust me, you wouldn't believe everybody's tests that we do, environmental pollutant panel, they're all loaded. And the other thing that's really hard on the kidneys is heavy metals. So you got to get rid of the things that are messing up your kidneys. So, I use kidney chi, I use Guna kidney, I use sound therapy on the kidneys to try to awaken it. I will maybe even do peptides to help the kidney. Might even help. And live cell therapy might help. So because you have to give cells to rejuvenate the organ or gland. And I've done those myself. Those
are referrals that we can give if we're working with a patient. Sometimes the peptides we have. But
so you're going to you need to, and check your hormones. So there's a lot you need to do if you have that. Lisinopril, that is not going to prevent the proteinuria, and that's not going to make it better. You got to work on getting things better. So.
Okay, we got through these, gang. So, and then I know there's a lot of questions here, but we're out of time. And what we'll do, like we always do, we take these Q&As or questions, and then we can answer and then submit them via email.
Right, and you can submit your questions, and I can do a little live Instagram to go over questions and post them. We can do that. Sydney's here, who helps coordinating our marketing efforts, and what she can do is we can do those, and the doctors can answer. We can all take turns answering them, because I know there's just an unlimited supply of questions, and they're all great because we all learn and we all get smarter and better, and we all can help each other get better. And I really want people to focus that we've got to focus on wellness and well-being, and not focus on if we get sick. We need to prevent illness. We need to all be practicing human optimization. The rate of illness is staggering, and it's not sustainable, and we're not going to have great communities if we don't each an individual focus and get well ourselves.
Agree. And that's our push in the year 2024. That's going to be our mission through the cancer conversation in the clinic. We really want to establish a better wellness, and we want to be, I told them, we want to be at the forefront of that. We want to be at the top end of that, because we have we are. We have the doctors, we have the clinic, we have the resources, we have it all. So we want to make sure that we continue to teach that and really push that wellness concept.
And you guys are our ambassadors to spread this information worldwide, because illness in other countries is not well either. It's not good either. So I know I have friends in all other countries, and they talk about the explosion of disease and illness. And so, but nobody spends as much as we do,
Right.
and we're not getting a good product. So we've got to change that and really prevent. And I know one of my friends, and I don't know too much about it, so you'll have to stay tuned. One of my doctor friends, he and a bunch of his partners started an insurance plan that will cover both natural and conventional medical therapies. So I just learned about it, and I'm supposed to have a big meeting with him, and because that would really help and revolutionize things and help a lot of people. So stay tuned.
And that's the wave of the future.
Yeah.
That's the necessity that has to happen. These things should be covered. That wellness, this is remedial, but prevention is always easier than the cure.
Yeah, prevention
and
is
significantly
priceless.
less expensive.
Right.
Too. So,
yes.
Okay, gang, I'll just review this quickly. Cancer Center for Healing. If there's something on here where you want to come and see us in the Cancer Center, 949-581-4673. Vicki will help you with that. She's really good with answering questions. The Hyperbaric Center, 949-680-1904. We have a full hyperbaric center with multiple units with CVAC as well, which we'll talk about at another time. We did that about 2 months ago. Perfectly Healthy Store for supplements, 866-616-7474 on the perfectlyhealthy.com website. And then the Center for New Medicine for the wellness side, that's your 949-680-1880. And that's Miles, who also does a really, really good job of helping guide you. And then the website, cfnmedicine.com. Okay? So have a great holiday. Be safe. Enjoy time with your family, your friends. We will see you in the new year. Hopefully with this new format, it might take a little while to get it going, but we will figure it out, and then we'll share that with you. But happy holidays to you all and to your family.
And God bless.
Yeah. Have a great one, y'all.